The American Civil War is one of the most transformative periods in American history. Beyond the political, social, and economic repercussions, it also had profound medical implications, particularly in the field of trauma surgery. The sheer magnitude of battlefield injuries and the prevailing medical practices of the era led to an overwhelming number of amputations. Today we take a brief look into the methods of surgery, the role of anesthesia, and the impact of weaponry, like the mini-ball, on the human body. In the midst of the pitched and the brutal battles of the Civil War, when speed was a necessity due to the sheer volume of casualties, surgeons had to be effective and efficient. As a result, many surgeries, particularly amputations, were expedited processes, something lasting mere minutes. The primary tool, the bone saw, was instrumental in these procedures. While the swiftness of these operations may be jarring to our contemporary understanding of medicine, they were essential in the context of the battle conditions and available resources, and however gruesome they might seem today, they saved lives. Contrary to popular belief, many Civil War surgeries were not conducted without anesthesia. The Civil War era marked the initial stages of the use of anesthesia in medical procedures. Surgeons often employed ether and chloroform to numb the pain or induce unconsciousness in their patients during operations. While these were valuable tools, they were not universally available. In many cases, due to dwindling supplies or the immediacy required by some injuries, some soldiers underwent operations without the relief of these agents. Amputations became a common medical procedure during the Civil War due to the extensive and devastating injuries that soldiers sustained. The rise in traumatic injuries can be attributed significantly to the introduction of a new type of bullet, the mini-ball. This soft, lead, conically shaped bullet would deform upon impact, causing extensive tissue damage and bone fractures. Often the damage was so severe that surgeons found it impossible to repair, making amputation the most feasible solution to prevent fatal infections such as gangrene. Civil War wounds, particularly those sustained from a gunshot, often resulted in higher fatality rates compared to wounds from earlier wars like the American Revolution. Several factors contributed to this increased deadliness. The technology and design of firearms underwent significant advancements between the Revolutionary War and the Civil War. By the time of the Civil War, most soldiers were equipped with rifled muskets, which had longer effective range and greater accuracy compared to the smoothbore muskets predominantly used during the Revolutionary War. The increased velocity of projectiles in the Civil War meant that bullets caused more traumatic injuries, shattering bones and causing extensive tissue damage. Amputation survival rates during the Civil War were contingent on various factors, most importantly the location of the wound. For instance, records indicate that in the Union Army, arm amputees had a survival rate of more than 70%, while leg amputees experienced a slightly lower rate, approximately 60%. These rates were influenced by factors such as the cleanliness of surgical tools, the location of the amputation, and the overall health and age of the patient. The Civil War marked significant progress in the use of anesthesia. Ether and chloroform, through their nascent stages, began to see more widespread use over the course of the war, allowing surgeons to perform the procedures with decreased patient pain. Surgeons became more skilled at these procedures out of sheer necessity, which, in turn, led to improved survival rates from those undergoing the procedure. With hospitals often overcrowded and conditions unsanitary, infections became a major cause of disease and death during the war. As a response to the rampant spread of diseases, there was a growing awareness of the importance of cleanliness. Dr. Jonathan Letterman, medical director of the Army of the Potomac, introduced ambulance to hospital systems that emphasized hygiene and sanitation. This period marked the beginning of a shift toward recognizing the importance of cleanliness in medical care, paving the way for the eventual acceptance of the germ theory of disease in subsequent decades. During the war, field hospitals were typically situated close to battlefields to ensure swift treatment of the wounded. These were established in a variety of places, like churches, barns, tents, or even in the open air. The primary criteria was speed and accessibility, so locations were chosen for convenience rather than suitability for medical care. As a result, these hospitals were often hastily set up, leading to a general lack of organization. Beds or simple cots would be lined up in close quarters, and the entire setup often suffered from inadequate sanitation. Dirt floors were common, sewage systems were minimal, and the risk of infection was high. Inside, the conditions were grim. Limited lighting from lanterns and candles and poor ventilation further compounded the challenges of providing care. Given the sheer number of wounded soldiers and the frequency of amputations as a primary medical intervention, discarded limbs would often accumulate around field hospitals, often being piled outside of surgical tents or in other nearby areas. The sight of these piles left a deep impression on soldiers and medical personnel and anyone who happened to witness them. The pile stood as a grim symbol of the war's brutality and the immense human cost of the conflict. After witnessing the pitfalls and gaps in medical knowledge during the war, there was a push for more structured medical education across the country. Many physicians, having learned from the horrors of war, returned with a newfound commitment to advancing the field. The post-war period saw an increase in medical schools and a shift toward more research-based, scientific approaches to medicine. The aftermath of the Civil War left a generation of soldiers grappling with their physical losses. However, adversity often brings out remarkable resilience. One such soldier was John Wesley Powell, a geologist and ethnologist who lost his right arm during the Battle of Shiloh. He is famously known for leading the Powell Geographic Expedition, which was the first thorough cartographic and scientific investigation of long segments of the Green and Colorado rivers in the western United States, including the first known passage through the Grand Canyon. In addition to the thousands of rank-and-file soldiers who survived amputations during the war, several famous men, too, carried grievous wounds for the rest of their lives after the cessation of battle. Men like General Oliver O. Howard, a Union Army general who lost his right arm at the Battle of Fair Oaks, and would later become known for founding and supporting educational institutions for freed slaves, including Howard University, which was named after him. General John Bell Hood, a Confederate general known for his aggressive tactics, lost the use of his left arm at Gettysburg, and later his right leg at Chickamauga. Union General Dan Sickles also lost a leg at the Battle of Gettysburg. Many other veterans, fortified by their shared experiences, banded together to form support groups after the war, aiding each other in navigating the challenges posed by their amputations. These groups often shared knowledge about prosthetics and provided emotional and financial support. The prevalence of amputations during the Civil War stands as a testament to the war's brutality and to the medical community's challenges and constraints. The Mini-Ball, with its devastating impacts on the human body, played a significant role in this grim chapter. Yet, amidst the pain and the loss, stories of endurance, unity, and hope emerged. The veterans who lived with their amputations not only survived but also thrived, exemplifying the indomitable human spirit. Thank you for watching this week's episode of Powderhorn History. If you enjoyed, please consider leaving a like or subscribing. Thank you.